Hey, can I get a chart, please?
Where am I today? I wish that I knew.
This is a Workscapes podcast. I'm Eric Finkhausen.
And I am Luke Plakowski. In this podcast, we will examine practices of a healthcare setting in transition from the patient paper records to electronic records.
As you know, the Obama administration has pretty much mandated that all healthcare providers switch from paper records to electronic records, or EHRs, using both a carrot and a stick. Doctors can get about $44,000 reimbursement for implementing certified EHRs. That's the carrot. And if they don't, then over time, their Medicare and Medicaid reimbursements will go down. That is the stick. The reason for the big push for EHRs is that the EHRs are supposed to make healthcare more efficient overall and reduce the ever-growing healthcare costs, which are the biggest long-term threat to our national budget. Medicare and Medicaid currently comprise about 19% of our national budget, but we are on a path where that will grow to become much, much larger.
And where is the efficiency going to come from? Well, if healthcare providers would have EHRs instead of paper charts, then we would eliminate the call we heard in the opening of this podcast.
Hey, can I get a chart, please?
This is Dusty at the front desk of the Feather River Tribal Health Clinic calling to the Medical Records Department requesting a patient's paper chart. Medical Records stores all of the paper charts, and someone in Medical Records will now have to get up, look for the chart, and bring it up front to Dusty. With EHRs, all that work would be superfluous. The nurse could just bring the patient to the examination room and bring up the patient's electronic record on the computer there.
So why haven't medical offices switched to EHRs before, when they have such obvious benefits? And note that the adoption rate really is quite low, 28% overall, and that includes many major hospitals. In smaller clinics, the adoption rate is even lower. In today's Work Practice podcast, we will examine how different employees of a clinic work with paper charts, and we'll see some of the work that is inefficient and can be automated. But we will also examine some powerful practices that may go some way to explain why paper is still so popular.
Four years ago, Feather River Tribal Health Clinic adopted an electronic health record system, or EHR, that was developed by their main funding source, the Indian Health Services. The system was based on the Veteran Administration's EHR, and by all accounts, the transition from paper charts was very challenging. But over time, the clinic's employees all learned to work with the new system and the new work processes.
The new system was especially advantageous for the staff in medical records, who are responsible for maintaining, filing, and retrieving the paper charts. Although they still have plenty of charts on their desk and in various piles around the room, it used to be much, much worse before the EHR was implemented. Some of the medical records people said that they barely had any desk space left for all the charts that were on their desks. So the transition to the EHR system made life a lot easier for the folks in medical records.
However, even though Feather River adopted the EHR system, they did not get rid of their paper charts. They kept both systems because the clinic receives a lot of documents from other providers, radiology reports, outside labs, and letters from outside specialists. And documents come to Feather River by fax or mail, and after adding them to the patient's paper charts, Feather River's providers must sign off on these reports.
So Feather River has this hybrid practice now with an EHR system for the data created internally and a paper chart containing the older records as well as the reports coming in from the outside. And this in turn allows us to take a look at how the folks in Feather River use both systems and the advantages and disadvantages of either.
When you consider the paper chart and compare it to the electronic record, it is clear that many of the practices surrounding the paper chart involve moving the chart to the appropriate place. Doctors need to have the chart with them in the examination room, and because we don't know what examination room the patient will end up in, the paper charts for that day's patients must be brought to the front desk, where the nurse will retrieve the chart when they lead the patient to an examination room.
For the folks in medical records, this means that they must ensure that the charts for the next day's patients are located and collected. Locating these charts is far from trivial. because the paper charts can be in multiple places. Indeed, locating charts is so time-consuming that the clerk whose responsibility it is to find charts does little else. And I have some first-hand understanding of this because I did the job myself for a few hours one afternoon. So the first place where you go look for charts is in the movable bookcases in which the paper charts are filed and organized alphabetically. But if the chart is not there, it can be in a number of other places, including
The provider shelves, which is where charts are placed that contain some new paperwork that the providers need to review and sign off on. Here the charts are not organized in any way, so you just need to read the names on each of the files.
or on what they call the table, which is really a cabinet where the providers put the charts that they have finished reviewing.
Or on the miscellaneous shelves, which is where charts are placed that require additional review and processing further by a medical records clerk.
Or they can be in the to be filed shelves, which is where the charts go that are ready to be filed again.
Or they can be elsewhere in medical records, as medical records clerks will often take charts that they need to work on to their desks or workstations.
Or finally, the chart may be on the floor, which to the medical records folks means it is not in medical records, but for example, it can be at the front desk or in one of the provider's offices.
Since finding a chart can be a laborious process, the folks in medical records often collaborate on locating a chart.
Girls, would you help me, give me a hand to fill in that sheet, please?
Everyone helps out by checking the charts on their desk, especially when it is urgent, such as when medical records gets a call with a request from the front desk for a chart, as we heard at the beginning of this podcast.
Can I get a chart for clinical, please?
This usually means that there's a patient that came in without an appointment. Locating charts has been such a big part of the job for so long that the medical records staff have developed this amazing memory about when they last saw a chart, and they are able to scan the items on many charts amazingly quickly.
Once all the paper charts for the next day's patients are located, they are put on a cart and wheeled to the front desk. Of course, once the providers have seen the patients, the charts must be returned to the medical records. So clerks must go and collect them from the floor regularly throughout the day.
Patient visits are not the only reason why charts are collected. Whenever the clinic receives a report from an outside provider by fax or mail, such as a lab report for a patient, for instance, the corresponding chart must be located to add the new data to it.
And it is not only finding and moving charts, there are other tedious paper processing work as well. Filing papers into charts, which involves punching holes, removing paper, putting the new paper in the appropriate place, removing the other paper, putting it back into place, filing paper from the left side of the chart to the tabs on the right side, and when the chart gets too thick, removing and archiving some of the older records and creating a new, thin chart.
So paper charts just require this immense amount of, well, paperwork. Filing papers, finding charts, moving charts, etc. It is so 20th century.
Thankfully, all of this work is going away when Federal River switches to scan the incoming paper directly into the HR. All this tedious work of schlepping charts through the clinic will finally be over. And a good thing too, because there is just no benefit to having all this paper. Welcome to the 21st century.
Well, not so fast. You are right that the medical records department will become much more efficient, but we should not dismiss all this paperwork as entirely without value. Some of the things the medical records folks do may seem tedious, but are actually quite valuable for the providers of the clinic. Here are some of the things that medical records currently does that are quite valuable.
The medical record clerks file all the new documents that the provider has not yet seen on the top of the left stack of paper, so that when a provider opens the manila folder, they know that the most recent data is always there on the left.
To make it easier yet, medical records clerks put flags on the left side of every page that a provider needs to review and sign. After a provider has signed all of the documents, they put the documents on a different shelf. The medical records clerks then remove the flags from the side of the page and put a new set of flags on the top edge of the paper to indicate to the provider that these documents were signed off but have not yet been discussed with the patient.
Another helpful work practice is that the clerks stamp each page that the provider needs to read and assess to determine what medical action needs to be taken. On this stamp, they can indicate whether lab results are within normal range or abnormal, and when they would like to see the patient again. medical records has a number of different stamps that they use for different documents. To help the provider out even further, the clerk looks up when the patient's next appointment is and notes it on the stamp. That way the provider can decide whether this is sufficient or if the patient should come in sooner. Obviously, this saves the provider considerable time. In short, the medical records folks prepare the paperwork for the provider, and they do so with considerable medical and organizational knowledge.
And all this work really pays off for the providers, allowing them to accomplish these mandatory reviews of documents in a short amount of time. All that is required of them is that they take the charts from their designated shelf, open them, look at the flags to see what pages need to be reviewed, read the documents, and then fill in the stamp to determine the next actions. While providers sometimes complain about the amount of paperwork they have to do, signing off on the charts does not take much time, thanks to all the preparatory work done by the clerks.
The advantages of the paper charts for the providers then are multiple. First, the paper is easy to read, much easier than the computer screen. The paper is easily annotated. The stamp provided by medical records is quickly filled out and signed. But other notes can be written right on the paper in the chart as well. Because the chart is physical, you can easily flip from one page to the next, and its logical organization, the most recent documents on top, makes it easy to navigate. The EHR is not as transparently organized. The minimal amount of formatting and structure requires the user to read a lot of text to determine where the important information is located. Additionally, a provider can see only one section of the EHR at a time. Clicking on a new tab removes the old information from view.
There is another benefit to the paper chart that is closely related to its main disadvantage, namely that it must be moved to the right location. Because the charts are physical, they must always be present in some place, and the mere presence of a paper chart provides a persistent reminder to the staff that some task needs to be done. As charts accumulate in a particular place, it can be an indication that someone needs help, and because the medical records staff are cross-trained, they can help out whomever needs it.
So looking at the practices around the paper chart, it is very plain that the electronic charts will automate a lot of work in the clinic as it does away with the searching for and moving of charts. But we should recognize that this work is largely back office work, and that while doing all this paperwork, the medical records folks also carefully prepare the paper charts for the providers so that the providers can go through them quickly. Indeed, in that sense, the medical record folks are like executive assistants. And in the transition to the EHR, this preparatory work is actually removed from the process and now needs to be done by providers. So for providers, the transition to EHRs is often very difficult and can mean a substantial loss of productivity. And as providers are often the decision makers when it comes to technology purchases, this may well explain why the medical industry has comparatively low penetration of information technology.